Hi, my name is Nicole Seawell, and today I'm going to be discussing the association between viral infections and islet autoimmunity leading to type 1 diabetes. I will be analyzing 3 different papers that address this possible association. Let's start by talking about the significance of viral infections. Within these papers, the authors mostly collected data on upper respiratory infections because the literature has previously shown that these types of viruses seem to have the largest contribution to the outcome of islet autoimmunity. Children develop an average of 6 viral respiratory infections a year. There is a large economic burden that occurs from upper respiratory infections each year, and everyone has been infected with the virus at some point in their life. The flu is a good example of a common upper respiratory infection that 25 million people seek healthcare because of each and every year. Type 1 diabetes, or juvenile diabetes, is an autoimmune disease that is diagnosed usually in the younger population. It develops when the immune system accidentally destroys the beta islet cells of the pancreas. The destruction of these cells is most likely due to an exaggerated immune response. However, scientists are still not sure if this is the direct cause of their loss of function. Destruction of these cells results in the inability to produce insulin, a hormone that regulates blood sugar levels in the body. Without manually being able to add insulin to the body to keep these levels in a safe range, the patient will eventually die. Islet autoimmunity normally precedes development of type 1 diabetes. It occurs when the body makes antibodies to the beta islet cells of the pancreas. These antibodies think that the cells are foreign and should be destroyed. This is significant because it could help provide early signs to the development of type 1 diabetes. There currently is no known cause or cure for this disease. Even though insulin therapy allows people with the disease to stay alive, it is in no way a cure. 1.25 million Americans are living with type 1 diabetes, and 40,000 more are diagnosed each year. Because of the constant need and amount of supplies diabetics require every day, there is a $14 billion in type 1 diabetes associated healthcare expenditures and lost income annually. The first study is by Lonrot et al. It was published in 2017. It is a prospective cohort study that took place from 2004 to 2010 with participants from 6 different clinical research centers located in Colorado, Georgia and Florida, Washington, Finland, Germany, and Sweden. The exposure was viral infections. They measured this by having parents record symptoms of illness and any subsequent diagnosis daily in a diary book. Parents' reports were translated to illness diagnosis codes by nurses every 3 months. The outcome was islet autoimmunity and was measured by radioimmunoassay analysis of blood samples for IAA, GADA, and IA2A autoantibodies. The measure of association was an adjusted hazard ratio of 1.42 with a confidence interval of 1.16 to 1.74 and a p-value less than 0.001. This study had several strengths, such as using 2 different methods for detecting presence of viral RNA and confirming the presence of viral RNA by conducting sequencing in order to identify species. They also had a large sample size of 8,676 participants and a long follow-up time of 6 years. The study did have some limitations, however, mostly resulting from the method of recording the exposure. Since the exposure was just measured by parents recording symptoms, there could be misclassification of infections, and there probably was an underestimate of the total number of infections. They could only confirm an infection if the parent took their child to the doctor and got a diagnosis for their symptoms. The second study is by Steen et al. It was published in 2010 and is a prospective cohort study that took place from 1993 to 2009 at a hospital in Denver, Colorado. They measured the exposure of viral infections by extracting viral RNA from blood samples and rectal swabs, then used the RNA to perform RT-PCR, a method that allows the researchers to identify the species of virus that is present in the sample. They also used the RNA to do partial sequencing to confirm the results that were seen in the RT-PCR. Lastly, they tested for viral antibodies to detect previous viral presence in the patient. They measured the outcome of islet autoimmunity in the same manner as the first study. The adjusted hazard ratio was 7.02 with a confidence interval of 1.95 to 25.3 and a p-value of less than 0.003. This is an extremely wide confidence interval, and this is most likely due to the way that they adjusted the hazard ratio, giving a very small sample size. The study's strengths were that they analyzed different seasons to see if a certain season was more likely to lead to islet autoimmunity. They also checked for autoantibodies every 3 months and had a large sample size overall. The limitation the study had was that they only used samples that they took to measure viral infections. Within the 3-month interval between samples, this could lead to an underestimation of the total number of infections that children had because the viral RNA will not be in the patient's serum for a long period of time after the initial infection. The last study is by Berlin et al. It was published in 2013 and is a prospective cohort study that took place from 2000 to 2009 at the Diabetes Research Institute in Munich, Germany. Also, like the first paper, they measured the exposure of viral infections by having parents record symptoms of infections and fever events daily, and then the parents' reports were translated to illness diagnosis codes by nurses. They also measured the outcome of islet autoimmunity the same way as the previous 2 studies. The measure of association was an adjusted hazard ratio of 2.27 with a confidence interval of 1.32 to 3.91. They did not report a p-value for this adjusted ratio, so it is hard to decide how significant this association is. The study had many strengths, like not just analyzing respiratory infections, but also gastrointestinal and other infections. They also had the parents record disease-free days as well as disease days. This allowed them to get additional information like duration of symptoms. They also created 4 different hypotheses for the mechanism behind how the viral infections led to islet autoimmunity. These 4 hypotheses were the total number of infectious events, the number of respiratory, gastrointestinal, and other infections separately, the number of fever events, and lastly, the number of infections without fever. The limitations that they had were in their small sample size of only 148 participants. They also only followed up the children for a total of 3 years, and this might not have been enough time to see seroconversion. They also did not report p-values for a lot of their data, and that does not make this study very reliable. Henneken's criteria is useful to determine association between exposure and outcome. In Study 1, the measure of association is an adjusted hazard ratio of 1.42. This indicates a strong association. This cannot be due to chance because the confidence interval is from 1.16 to 1.74 and does not include the number 1. In Study 2, the hazard ratio is 7.02 and the confidence interval is 1.95 to 25.3. This also shows that this association cannot be due to chance alone, even though the confidence interval is very wide. In the third study, the hazard ratio is 2.27 with a confidence interval of 1.32 to 3.91. All of these studies have strong or very strong hazard ratios between viral infections and islet autoimmunity. 2 of the same confounders, sex and delivery mode, were controlled for in each of these studies. Each individual study also controls for many other confounders, as can be seen in this table. Each study had different types of bias. All 3 studies have information bias resulting from the possibility of inaccurately underestimating the number of viral infections each child is acquiring throughout the study. In Study 1 and 3, there is recall bias occurring from the parents recording symptoms, and there also is misclassification bias because the researchers only used the parents' records to measure the amount of viral infections. All the studies were able to establish temporality because we can measure islet autoimmunity occurring after the exposure of being infected by viruses that cause upper respiratory infections. All 3 studies also show a dose response because the more viral infections that the children have, the greater the likelihood that they will develop islet autoimmunity. Biologic plausibility occurs because there is research showing that a virus has the ability to create an immune response that leads to the accidental destruction of our own cells. And these studies are consistent with this theory. making all three of the studies consistent with all previous research. Some future directions that could be done to research the association between viral infections and type 1 diabetes would be to conduct other studies that have a longer follow-up time. This would allow researchers to actually see how many of these children that seroconverted to islet autoimmunity went on to developing type 1 diabetes later in life. It would also be useful to research the mechanism of action between the virus and the cells in the pancreas. Knowing what the virus does to make these cells stop working could potentially create ways to prevent this destruction from even happening. If scientists could determine the species of virus that has the largest contribution to the association, then we could develop a vaccine that might be able to reduce the number of new cases of type 1 diabetes. All of these things would greatly help future generations from developing this incurable disease. In summary, all three studies were able to show a relatively strong association between viral infections and islet autoimmunity. These studies are consistent with the idea that viral infections could trigger an exaggerated immune response that leads to the destruction of the cells in the pancreas. There are many other factors that could contribute to type 1 diabetes, like diet and other environmental factors. However, it is possible proof of this association that could lead to the development of a way to try to reduce the incidence of type 1 diabetes in future generations. Thank you, and these are my references.